This week on Africa Health Check.
We didn't go for tests. Test is expensive, so we didn't go. And later we recovered anyway.
I totally disagree with the vaccine being made mandatory because I feel everybody has got the right to choose.
We look at the future of the African continent.
One issue that we need to look at, as particularly in Africa, is the fact that we need to develop capability into a point where we're not so dependent on other parts of the world.
As we live in the COVID-19 era. Good day and welcome to Africa Health Check, where we reflect on Africa's response to the COVID-19 pandemic. I'm Horontlejang Paladi. On today's show, we will be discussing Africa's future after COVID-19. But before we do that, let us have a look at Africa in numbers. This week on Africa in numbers, we look at the daily new COVID-19 death rates on the continent and highlight the top countries reporting the highest 7-day average rates as of the 20th of February 2022. South Africa's 239 daily deaths is the highest daily death rate average on the continent, followed by Tunisia with 63, Egypt with 58, Morocco with 16, and Algeria reporting an average of 10 daily deaths. For more on these statistics, log on to the official Africa CDC website. And that is our Africa numbers for this episode. And as I've already said, we will be discussing the future of Africa after COVID-19. And to help me with that discussion, our special guest for today is Dr. Githinji Githai, who's the Group CEO of Amref Health Africa. We also have our usual commentators, Dr. Marianne Morathi, who's the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya. We also have Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from these experts, let us hear what people on the street had to say.
One issue that we need to look at, as particularly in Africa, is the fact that we need to develop capability into a point where we're not so dependent on other parts of the world. Yet we have all the talented people in the African region. However, our governments must create the enabling environment, that enabling environment for the talents we have in Africa to function maximally so that they can be part of the contributors to the solution to COVID rather than consumers of the product of other countries.
And that is the word on the street for this particular episode, where we are discussing Africa's future past the COVID-19 pandemic. I'd like to take this moment to welcome our special guest and panelist, Dr. Githinji. Welcome to the show.
Thank you very much, Gigi. Thank you.
Thank you so much. Maybe let's start off by just allowing you to just introduce yourself briefly.
So my name, as you've said, is Dr. Githinji Githai. I'm Kenyan by birth, but global by vision and work. And I am a medical doctor, trained medical doctor. I practiced in Kenya for a few years, but then I moved on into health policy and advocacy many years ago. That will probably be more than 15 years ago. And then currently, I work with Amref Health Africa, which is Africa's largest health development organization that's actually born, bred, and headquartered in Africa. We are headquartered in Kenya, but we have offices and operations across the continent and also offices in Europe and North America that help us with fundraising. So that is me. And previously, I worked with an organization called Smile Train, where we were providing free care for children who are born with cleft lip and palate. So I have been in health development for several years now. But I'm also passionate about family, passionate about people, and everything I do, I start with people first.
Wow. We are talking about the future of Africa past COVID-19, and I want you to weigh in there. There's so many things that countries are focusing on. There's economic recovery, there is getting vaccines to as many people as possible, there's strengthening healthcare system. What do you think should be the priority?
This is a very complex question, Gigi, because every time we ask this question, many people will tend to take an advocacy approach to this question, to say government need to do better, government need to pay attention to this and that, they need to provide more money. But I would like to paint a picture here that actually kind of gives us some sobriety about the situation we are in, where we have been, where we are, and where we are going. And the first thing to say is that the African economy is small. The African economy is less than 3% of the global economy. But that African economy, which is less than 3% of the global economy, is taking care of a population of 17% of the global population. So already you can see that there's a big problem, that 17% of the global population is relying on 3%, and the rest of them are relying on 97%. What does this mean? This means that, therefore, Africa has a low tax collection. And that tax collection, because you're collecting little money from a little economy for many people. And social services like health are provided through taxes. Taxes are collected to provide social welfare, education, health, shelter for those who can afford it. So when you now look at this 3% of the global economy with 17% of the population, and you start to look at how governments collect taxes for them to be able to do these things, you then discover actually that the tax efficiency is even made worse, not only by the little economy, but the fact that majority of us in Africa are working in the informal economy. So eventually you collect very little taxes. And when you allocate, even if you are to allocate 15% of what we talked about in the Abuja declaration to health, I have done my own back of the envelope calculation, Gigi, and I've found that when you do all this, the best amount of money, the most amount of money Africa can get per individual to spend on health in the public expenditure, after accounting for increased tax efficiency, after accounting for minimal corruption, and after accounting for equitable allocation, you end up with $50 per person per year for health. $50 is the best we can get when you average across sub-Saharan Africa. Put that alongside the UK that spends $4,000 of public money per person per year. Put that again in the US that spends $5,000 per person per year. And across Europe, what you may call the OECD countries, it is an average of $3,500 to $4,000. So you now start to see what the problem is. The problem is complex, and the problem is financial, but then it's also population development. Because if Africa, which is now the continent with the fastest growing population, was actually to provide sexual and reproductive health and rights to people to understand how to space their families, then it means that over time, as the economy grows and we have a lower fertility per woman, then you may end up in a place where the economy is able to take care of its people. But with a growing population, the problem becomes even more complicated.
Absolutely. I think I totally agree with you that it is indeed complex and it's multifaceted. But I wanted to ask you, what do you think are the most short-term, most immediate things that we can do as different stakeholders? This is not just government, but private sector, civil society. What can we do in the most immediate short term to be able to contribute to some of these discrepancies that we see in lack of access to financing, strengthening the healthcare system, sexual reproductive health issues, and the broader continuum of care? Are there any little pocket of things that we can do that can contribute to the overall agenda?
Yes, there are things that we can do and we can do right now. And the one and the most important thing is actually to remodel our health system. Our health system is built on the health system from our colonizers. It's built on the fact that tertiary care and secondary care is the most important. And therefore, we see our focus on the specialists, on the ministries of health, on government, on the politicians, being on the large hospitals, cancer centers, referral hospitals. Whereas the big, the big impact will be found if we are actually to shift and start to think about health prevention and promotion and build the community health system, empower community health workers, so that when a woman is pregnant, the first thing they do is they know they need to go for antenatal care. When a man has hypertension or a woman has hypertension, there's somebody who tells them early enough before they develop, complications. That there's somebody who is checking the blood sugar of the community before people go to the hospital, so that actually they know that they can actually control their sugar before they need dialysis, because now they have chronic renal failure. If we don't do that, then it means we'll never afford healthcare because we'll be waiting for the most expensive part of healthcare, which is curative. So we must remodel the health system. That's the immediate thing. Focus on community, people-centered, and get community health workers and put them as priority over all, as you build the cadre, but it's continuum. So you must consider every other cadre, but build community up. The second thing is to empower the people, because the people can demand better care. Right now, Gigi, that if a woman goes to a hospital, loses their child, they say it's God's will. But it's not God's will, because they would have received better care if the people demand better care from the duty bearers. And those duty bearers are government and their leaders and politicians. So this is the other thing we need to do. Community and social participation is critical in every country.
Absolutely. Thank you very much, Dr. G. I'm going to jump to Dr. Marianne. Maybe you could also weigh in there. What are the mistakes that we need to look out for and make sure we do not repeat if we are to indeed strengthen our healthcare system and make sure that it is ready for any pandemic and is actually proactive towards addressing health issues?
Yes, so some of the lessons you've learned from COVID and going on forward from this pandemic, first of all, is to have our surveillance systems working very well, because we need warning systems to tell us this pandemic or this pathogen is coming. Right now, in fact, in terms of research, we are even looking forward to the disease we call pathogen X. A pathogen is going to come that may cripple our systems down. So what are we doing about it? We need very good surveillance, good patrol all around us, within our borders, within countries, and also very good communication, so that whatever is happening, let's say in Cambodia or a far-off country in China, perhaps, that we in Kenya, we in Africa, we are prepared and we have systems ready to be able to detect, to be able to deploy testing systems, so that if it's already in Kenya, what are we going to do about it? So for me, as a researcher, and we also call ourselves a virus hunter, we are quite aware and quite passionate in developing these systems, in developing testing strategies and detecting any unusual fevers or any unusual symptoms, and then having structures to report this all the way down to the ministries, to the correct people, so that you can address this. So I'm speaking from a practical perspective on what we need to learn from this and what to do right in the next time.
Thank you very much for that, Dr. Marianne. I'm going to go to Reverend Dr. Githinji says something very interesting, that it is not the will of God where a mother can be prevented from losing their child. So maybe you can weigh in there on what is the role of the community in helping us ensure that we strengthen our healthcare system, our referral system, and just overall the continuum of care.
Yeah, I believe that the solution is a collective effort. I do believe that it is time, for us, unlike Dr. G. Let me use Dr. G. has read. There must be a revision of our healthcare delivery systems, and then approach it from that end. That okay, even though there have been countries that have been generous to donate millions of doses of vaccines, sending us PPEs and things like that. When will Africa understand that health is wealth? So we are sitting up and then brainstorming to come up with concrete ideas as to how we can resolve this issue. So until the whole plan, the whole masses of people across Africa, we come together to revise and to come up with solutions as to how we will take care of ourselves, like Dr. G has enumerated in this how do you call it, maternal health or whatever thing he cited. We are not ready for the future. The future will be bright for Africa if we can look at what has happened now with COVID and our inability to respond immediately. If we are able to sit up and then drum up and come up with some ideas, i.e. challenge our pharmaceutical and medical manufacturing companies, challenge our governments and our leaders to give and to support the health institution. We are not ready for the future. And any other pandemic, of course, we are not out of the woods yet, but any other thing that hits us will be very damaging.
Absolutely. Thank you very much for that. We're going to continue this conversation on the other side of the break. But for now, it is time for us to have a look at what people on the street had to say.
According to the situation that we are going through, I think the only way is for the mandatory vaccine to be implemented here in Malawi. Yes, we might talk about people's rights, but what is the most paramount right? I think the right to life is paramount. So much as we do respect the people's right to have a choice either to get vaccinated or not, but I think mandatory vaccination would be the way to go.
Should vaccines be made mandatory, is according to me. I believe it's a violation of a basic human right, because more special is something which is going to get in your body. So as for me, I believe they should not be made mandatory. People should be allowed to choose.
Welcome back from the break, and do remember you're watching Africa Health Check, and today we are talking about Africa's future past COVID-19. Dr. G, let us talk about whether we've learned enough and we are actually going to enhance our capacity to be able to locally procure vaccines and other healthcare commodities, because that was also another challenge. You know, we had to get commodities from the West and wait to be at their mercy to receive those commodities. So what are we saying here as Africa in ensuring that we safeguard the capacity for local procurement of healthcare commodities?
Yeah, this is a really critical issue, Gigi. And the issue is that we first need to realize that Africa is a fragmented continent. So you have 55 member states, and each of them independent regulatory mechanism, independent everything. And that results in geopolitical competition. So every country wants to be the first one to do this, the first one to do that, so that their people can vote for them. And this doesn't help the continent. And this is why, for the longest, the continent has depended on vaccines procured from outside the continent. Africa only produces 1%, only 1% of the vaccines that it consumes. But out of the other 99 that come in, where do they come from? They come from funded programs by the Global Vaccine Alliance. So it's not African countries buying them. Many of them, other than the countries that are Northern Africa and maybe South Africa, majority of the other countries are receiving from the Global Vaccine Alliance, which brings a very interesting angle that even if Africa was to manufacture its vaccines, who will buy them? Because if all the vaccines coming are free, then who will buy them? Which then says that for Africa, for the future, we need to do several things, and I conclude. One, we need to create a common market. And I think the Africa Continental Free Trade Area is very timely, and countries need to take it very seriously. Secondly, we need to create a common regulatory framework. There is already a treaty, the Africa Medicines Agency Treaty, and it needs to be ratified so that if a vaccine is manufactured in Senegal, it can then be available across the continent without every country trying to go and regulate it or approve it. Now, if we do these things, then we ask ourselves the last question. Because vaccines are a public good, and in the current public health order, they are funded by donors in most countries. The donors fund them through the Global Vaccine Alliance. It's not the countries that go and purchase and compete on their own. So then we have to ask ourselves, how do we ensure that the vaccines we manufacture or the commodities we manufacture in the continent are also in the global market, so that we stop looking at manufacturing, Africa manufacturing for Africa, but we must prepare Africa to manufacture for the world so that the standards are global, the markets are global, and Africa is only a beneficiary of its own capacity. That's what India did. And we now importing from, they didn't do it to serve India. They did it to serve the world. So Africa must look at this agenda holistically, to serve the world, not to serve Africa, which is very simplistic.
Absolutely agree with you, Dr. G. And maybe just to jump to Dr. Marianne, you know, you are also a frontline worker, and you also experience a lot of shortages of other healthcare commodities beyond vaccines, PPEs, masks, and so many other things. So what do you think needs to happen in the short and immediate term by different stakeholders to ensure that we enhance our capacity to locally manufacture, produce, and even procure these commodities?
So to locally produce these commodities and make sure that we never have to run on those shortages again, we need to first of all strengthen, as Dr. Githinji has mentioned, the community engagement. And we saw some examples here in Kenya where some communities got together and we could see them making masks, making PPEs for healthcare workers, for the front line, and that was well appreciated. But we need this to be on a continuous basis because, again, we need to have that pandemic preparedness in that we are never caught short-footed again. In terms of having enough tests as well, you saw the situation in the United States where the CDC somehow lagged behind in coming up with tests so that they could advise their government in terms of this pandemic or this virus has already settled in their country. Can we have enough tests also locally manufactured here? We have the capabilities. In summary, is increasing and enhancing our health systems so that we are reaching even to the far-fledged places in our country and around the continent so that they're well served and well prepared. So yes, we can work together, we can work as a team and get this done.
Thank you very much for that, Dr. Marianne. And to go to you, Reverend, how do we motivate the political will and commitment to ensure that what Dr. Marianne and Dr. G were talking about actually happens? Because we've had many of these political statements and commitments, and then, we've learned a lot, but nothing happens after that. So how do we change the narrative to make sure that we actually do something about all that we've learned?
I do believe that our people will have to understand that they are there for the people. Political leaders, opinion leaders are there for the electorate, the people that put them in power. And it's for their welfare and it's for their survival. So then they need to come together and avoid all these divisiveness and conflicts and attack and all those kind of things. Let me say this, in reference to what Dr. Miriam and Dr. G have said, that the CDC Africa, that is the Center for Disease Control and Prevention, has this ambitious goal to vaccinate about 70% of Africa's population, which is more than 750 or even 800 million. Now, through the kind, generous donation of the COVAX facility, AVAT, that is African Vaccine Acquisition Trust, and then the partnership of MasterCard Foundation, this lady, Rita Roy, and their donation of 1.3 billion, towards CDC's goal. To talk about access to vaccines is quite something. Even those in some pockets of Africa, it might be so. But in Ghana, I will say that the vaccines are available. The vaccines are available. Let us come together. And as a pharmacist and as a religious leader, my word to us all will be that let us encourage our people to listen to science and then hold on tenaciously to our faith in God and then vaccinate and get this thing over with. Because without it, we cannot see any way forward. The opportunities are there, the potentials are there, the brains are there, and if we can come together, the future is ours. Thank you very much.
Absolutely true. I couldn't agree more with you, Reverend. Really powerful, motivating, and encouraging words. I'm going to go to Dr. G. You have the final say to wrap up this show. And I want you now to speak to an African listening to this anywhere in Africa or in the diaspora. And they're wondering, what is my role? What can I do? We're talking about Africa, the future. We're talking about recovering from COVID-19, living with COVID-19. And most importantly, we are talking about thriving as Africans and as Africa. I want you to give your final message to us.
My final message to each one of us across our nations in the continent is that we need to stop being nationals and become citizens. Nationals are people who hold a passport of a country. Citizens are people who engage with their country actively. We must all be citizens of our countries, and we must then be empowered with information. And that information needs to be from the right sources. We need to work closely with our leaders, religious leaders, local leaders, community leaders. We need to work closely so that we ensure that the power that changes the country comes from the bottom, not from the top. Because, you know, at the end of the day, everyone has a boss, and the boss of government is the people. It is the people who actually put the government in power, and it's the people who are the duty owners. They are the right owners. They are the ones who own the rights. But the government they put in power is the duty bearer and must ensure that they actually give the right to the people. But they will not do so unless they have an enlightened citizenry that is actively engaged, that is actively participating, and the structures already exist in this continent. The religious platforms are a strong way to actually engage with the politicians and governments. And we should use those structures that exist, civil structures, civil society, community-based organizations, so that we engage for a better future. Thank you.
Absolutely powerful, very inspiring message, Dr. G. I just want to say thank you so much for taking time from your busy schedule to be part of this show. We really appreciate your insights. We wish you very well, and we look forward to also interacting with all the work that AMREF is doing around the world.
Thank you very much. Thank you.
And I just want to also send a very special thank you to Reverend Anthony Achampong as well as Dr. Marianne Morethi. This is our 12th and the last show that we're doing together. It's been a great pleasure working with you both. We've learned a lot about Ghana, about Nigeria, about healthcare professional, about community engagements that you are engaged in. I just want to say, please keep up the great work that you're doing offline. And I certainly hope that we'll have an opportunity to work together again as we did on this Africa Health Check. We have come to the end of today's show, as well as the end of this 12-part series that we have been doing at Africa Health Check, reflecting on Africa's response to the COVID-19 pandemic, more especially shining a spotlight on actions, efforts, and contributions of ordinary people, different entities, institutions across Africa towards the COVID-19 response, because it has been a collective effort. It cannot be any singular person or any single government's responsibility. It is our collective responsibility as Africans to really contribute to the response. And as the experts have already said, it is, at the end of the day, our responsibility as individuals, as Africans, to stop being nationals, to be citizens, and actively take part in what is happening in our countries. And it just starts at community level. Ask yourself today, what am I doing for the betterment of my community? What am I doing to improve the standard of living and the livelihoods of people around me? Because all of us have a social responsibility, and all of us have to play our role if we want to see that collective difference, and if we do want to see that beautiful and fruitful and nourishing future that we want to take Africa to. Thank you very much for being part of the show. Do connect with us, Africa Health Check, on social media. We want to hear from you from now on, and do remember that the future is Africa, the future is today.